morning, everyone. I'm excited to chat with you briefly this morning on the first day of Care Team Appreciation Week. I want to thank you for what you do every day for our community. And I want to tell you a story that I think really captures what we do as a healthcare system. I had the fortune to be at the YMCA annual awards dinner approximately 2 months ago, and an individual received an award and proceeded to the front of the room and told his story. And it was a story that was quite powerful about the work that you do. He shared that he and his longtime wife had lived together in northern Maine when she had an unfortunate and serious cancer diagnosis. He and his wife knew that they wanted to receive the best possible care for her, so they reached out to loved ones and friends and said, "Where can we get the best care?" And after hearing from those friends, they chose to move to the Brunswick area so that they could get care at Mid Coast-Parkview Health. She survived over 10 years, but unfortunately eventually succumbed to her diagnosis. Her husband then had a primary care visit appointment for himself approximately a week after she passed away. He was exhausted and sad and relatively hopeless about what was going to come next. He saw his physician and talked about his conditions, and at the end of his visit, his primary physician, Dr. Matt Hanna, told him he needed to do 2 things. The patient said, "I don't have any energy to do anything. I just had my wife pass away. I'm so sad." And Dr. Hanna said, "You still need to do these 2 things. You need to lose 30 pounds and you need to get a social life." The patient shared that his wife was the social one in the family. The friendships all came through her. He was a shy individual and he didn't know how he would go about that. And Dr. Hanna said, "You're going to go to the YMCA at 6 o'clock every morning, and you're going to walk on the walking track, and you're going to hold your head up and make eye contact and say good morning to anybody you see." The individual said, "Why do I have to go at 6 in the morning? I'm not a morning person." And Dr. Hanna said, "Because that's where your new friends go to the YMCA. That's where you're going to meet them." So being of a generation that follows doctor's orders, he went to the YMCA and he noted that on the 3rd or 4th day, he started to connect with a few other gentlemen and they started talking about the previous night's Celtics basketball game. He then ran into a neighbor who brought him to a fitness class at 7 o'clock in the morning, and he kept going. In that first year, he lost 40 pounds. He shared that he also struck up a strong friendship with a new person, a woman who had lost her husband to a cancer diagnosis about 3 years before. And now 3 years later, that friendship is going strong. He shared in the story that they were driving together, and he thought as he was driving that he's living his life looking forward through the windshield, and that if he hadn't taken those instructions from his doctor and acted upon them, he would have been living looking at the rearview mirror and looking back at what life had been. He was so grateful that he has a happy life and is excited about what's coming next. Nearly everyone in the room was reaching for tissues during that story, and I couldn't have been more proud. While our primary care providers do this work every single day, multiple times, they're not the only ones responsible for this amazing care. Our PSRs, who check patients in with kindness and a smile and welcoming them, is what led family members to say, "This is a great place to get care." Our physical therapists took care of family members and had them saying, "Great care is offered at Mid Coast-Parkview Health." Our facilities team do a spectacular job of making sure we are safe and in a beautiful facility. And when people come here for care, they see it. They have confidence in the care we provide because our facilities look so beautiful. I would like to go through and thank every single department because you all contribute to this, but you would have to listen to me for another 10 minutes, and that's too much. So I'd like to challenge you for this. Just try to think how you don't contribute to that story, because I'm telling you, you will be wrong. If you're here, you contributed to that story. You contributed to changing that man's life. And I'm so grateful for what you do to make that happen. On Care Team Appreciation Week, I want to especially thank you all. I can't wait to see people in person out being about and thanking you. I know the rest of our teams will be as well. And I hope everyone has a great week, but know that you're appreciated all the time, not just this week. Thank you for all that you do every day.